Nursing graduates are so excited to have finally made it through nursing school. Then they study and study and study some more to pass the most important test of their life, the NCLEX. Well, thankfully, they pass. Now, it is time to start their career with their first nursing job. After classroom orientation for a week or two, the new nurse is assigned to work on the unit taking care of real clients. Hopefully, the new nurse will have a preceptor. Within a few days or weeks, the new nurse is depressed and has gone into reality shock. Comments like, I did not learn anything I need to know about being a nurse in nursing school. Nursing school only taught me how to pass NCLEX. Or, I am so frustrated, I don't know anything. Well, here's what you need to understand. When a new graduate gets out of the nursing school, that new nurse is a novice nurse. In other words, you know how to be a safe nurse. The key is also knowing when you do not know something and how to seek out the correct answer to that issue. How? Well, look at the policy and procedure manual. Rely on your preceptor or supervisor. You cannot know everything as a novice nurse, but you must practice safely. During nursing school, the student is considered to be a novice nurse. It takes up to 5 years for that new nurse to become an expert nurse. Dr. Patricia Benner first introduced the concept of becoming an expert nurse in 1982. This concept revolves around the understanding that expert nurses develop skills and understanding of client care over time and through a sound educational base as well as large quantity of experiences. Please take a moment to review the objectives for Chapter 8, Entry into Practice. A paradigm shift, a concept identified by the American physicist and philosopher Thomas Kuhn, is fundamental change in the basic concepts and experimental practices of a science discipline. What is the difference between knowing how and knowing that? What the new graduate is experiencing is a shift from being a student, learning skills and acquiring knowledge under the guidance of an instructor, to being a new nurse, which is accountable for her own practice, but having relatively little clinical experience. According to Dr. Patricia Benner, there is a difference between theoretical learning, classroom learning, and clinical practice. Benner refers to the information you learn in school as the knowing that information. It is the foundation of your knowledge base for practicing nursing. Benner explains that the second type of knowledge that is necessary to move from being a novice to becoming an expert nurse is knowing how, or the information that nurses learn while practicing their art in the real world of nursing. Benner developed a concept known as from novice to expert. And this concept explains that nurses develop skills and an understanding of patient care over time from a combination of a strong educational foundation and personal experiences. She describes this as a nurse knowing how without knowing that. She further explains that the development of knowledge in fields such as nursing is made up of the extension of knowledge through research and understanding through clinical experience. Dr. Banner introduced the concept that expert nurses develop skills in understanding of patient care over time through a sound educational base as well as a multitude of experiences. This theory identifies 5 levels of nursing experience: novice, advanced beginner, competent, proficient, and expert. Let's look at them. A novice is a beginner with no experience. They are taught general rules to help perform tasks, and their rule-governed behavior is limited and quite inflexible. In other words, they are told what to do and simply follow instructions. The advanced beginner shows acceptable performance and has gained some prior experience in actual nursing situations. This helps the nurse recognize recurring meaningful components so that principles based on those experiences began to formulate in order to guide actions. A competent nurse generally has 2 or 3 years of experience on the job in the same field. For example, 2 or 3 years in intensive care. The experience may be also similar to day-to-day situations. These nurses are more aware of long-term goals and they gain perspective from planning their own actions, which in return helps them achieve greater efficiency and organization. A proficient nurse perceives and understands situations as whole parts. He or she has a more holistic understanding of nursing, which improves decision making. These nurses learn from experiences what to expect in certain situations as well as how to modify plans as needed. Expert nurses no longer rely on principles, rules, or guidelines to connect situations and determine actions. They have this deeper background of experience and an intuitive grasp of clinical situations. Their performances are fluid and flexible and highly proficient. Banner writings explain that nursing skills through experience are a prerequisite for becoming an expert nurse. An important so-called knowing that concept is understanding the laws that govern your practice as a nurse. After you graduate and pass the National Council Licensure Examination for Practical Nurses, NCLEX PN, you are permitted to practice nursing within the framework of the LVN Nurse Practice Act in your state. The Nurse Practice Act is the most significant law governing your practice, and a Nurse Practice Act is the law in each state that defines nursing and what the various levels of nurses legally may do in their practice. The State Board of Nursing consists of nurses and others who generally are appointed by the governor to serve as the enforcement arm of the Nurse Practice Act. The nurse practice laws differ from state to state. Some laws are very specific and some laws are more general. It is essential that you assume the responsibility to understand thoroughly the role of the LVN in the state where you work. It is required that LVNs work under the supervision of a registered nurse or a physician. In addition to that, to defining what nursing is for a state, a Nurse Practice Act directs the State Board of Nursing in establishing the criteria for licensure and defining violations that can be disciplined by the board. The policies and procedures of all employers should follow the Nurse Practice Act. If they don't, it is your responsibility to know the law and follow it, despite the hospital's policy. If you do not follow the law as outlined, you may be in a violation, which would put your license in jeopardy. You can access the Nurse Practice Act for your state by going to the National Council of State Board of Nursing website at www.ncsbn.org/npa.htm, or for California to the BVNPT website and search for Nurse Practice Act. The second concept that has an impact on your successful entry into the practice of nursing is applying your understanding of Maslow's hierarchy of needs. Do you remember that the first need on this pyramid is actually survival or basic physiological needs? Generally, going to work as an LVN does not have a negative impact on your ability to breathe, eat, and move. Now, the second level of needs, safety, however, may be threatened as you make your transition from student to practicing nurse. A situation in which you feel inadequate in your job as an LVN could result in a serious mistake that would hurt the patient and possibly jeopardize your nursing license. There's no doubt getting your first nursing job is a big and important step that can set you on a great career path. Finding a job, however, is only the first of two big things you need to think about as you move through this once-in-a-career period between nursing school and work. The second thing is making sure the first nursing job you get is the right one for you. In 2005, The authors Harding, Pierce, and Butler cite 53% of new graduates changing their job within their first year of work. Is that because they took the first job offered to them and didn't do any research ahead of time? Well, the first step is identifying the perfect job should be objective. This involves answering three major questions. What is the job really like on a day-to-day basis? What skills and experience do you need to learn as you gain knowing how clinical experience? What are the support systems available at the job for a new graduate? For example, do they have orientation, preceptorship? Do they have additional classes? Well, bottom line, don't take a job without knowing the answer to the questions listed under Be Objective. Or you could be very disappointed and disgruntled and be looking for another job right away. When nurses take on new and unfamiliar roles, they often begin at the novice stage. Novices use rules and facts to guide their actions. They adhere to these rules without consideration for the context of the situation. These rules are limiting since no rule can tell the novice which tasks are more relevant in an actual situation and when it is acceptable to make exceptions to the rule. Novice nurses are unable to view situations as a whole. Rather, they see the individual parts. It is difficult or near impossible for them to put all the parts together and see the big picture. They are concerned so much with the tasks at hand that they cannot do more than one thing at a time. Mentoring is a broad, caring role that encompasses formal as well as informal supporting, guiding, coaching, teaching, role modeling, counseling, advocating, networking, and sharing. Mentoring has been defined as a one-to-one long-term trusting relationship, spending sometimes months to many years. And this relationship develops over time between a novice and a more experienced practitioner. A mentor is an experienced practitioner who establishes a caring relationship with a novice nurse as a trusted counselor, guide, role model, teacher, and why not a friend, providing opportunities for personal and career development and growth, and support to the less experienced individual. The mentor-mentee is a creative partnership based on trust and respect. Both parties share the responsibility for the success. Mentors are expected to role model as leaders while sustaining a professional relationship with a student. The relationship is actually bidirectional in that the mentor's expectations for the mentees are maintaining open communication, readiness to learn, and analyze the processes. Qualities that make for a good mentor are patience and passion to teach or share knowledge with others. Good mentors do this in a way that allows others to understand them and not feel insignificant or stupid. Good mentors admit when they do not have an answer and actually go through the process with you to figure out how to find the right answer. They are easily accessible and approachable. Other qualities that make for good mentors include 1. They act as role models, treating new nurses the way they would want them to be treated. Second one, they educate new nurses on company culture. The third one will be they help new nurses network with other healthcare professionals. 4, they offer constructive criticism. 5, they help identifying areas of growth for new nurses. 6, they give praise when it is deserved. 7, they share their own learning experiences and mistakes with the new nurses. 8, they keep their promises. 9, they are trustworthy and make new nurses feel comfortable coming to them with any dilemmas. And the last one, number 10, they are open to feedback from the new nurses. Identifying a mentor is the first challenge. As with any relationship, the mentor-mentee relationship has the potential to be dysfunctional or toxic. A toxic mentor is a term often used to describe a relationship that hinders or suppresses student learning, creates a dependency on the mentor, and results in diminished self-confidence on the part of the learner. Now that we've gone through the list of what you should be looking for, let's also be on the lookout to avoid these types of mentors. So we have the avoiders, the elusive practice facilitator who is never available to the learner to set and review their practice and goals or to provide support or challenge in the role modeling. The blockers. This practice facilitator blocks the learner's development either consciously or unconsciously in a number of ways, such as preventing them from accessing learning, over-supervising, or by withholding knowledge or information. The destroyers. Here, the practice facilitator uses overt challenges and uses tactics such as humiliation that is set out to destroy the learner's self-confidence. Dumpers. Well, this type of practice facilitator believes in sink or swim and will often deliberately leave the learner in new situations where they are out of their depth. Aldous Huxley once commented, and I quote, "There is only one corner of the universe you can be certain of improving, and that is your own self." Self-mentoring means cultivating your own professional growth through reflection, networking, and seeking out appropriate resources. The process clearly requires motivation and self-discipline. And here are some strategies to use. Observe the behaviors of others you admire. Talk to people you believe are experts in the field. Read, and read. Always take further educational classes. And always be open to feedback. 3 other strategies can help you make a successful transition to your new role or new job. Networking, motivation, and commitment to lifelong learning. The modern LVN has the ability to enhance nursing practice with certifications. A certification is not an aspect of the LVN license. It is a separate certificate for learning a special skill. The most common is IV therapy and blood withdrawal and wound care certifications. It is one way an LVN can expand practice without obtaining an RN license. It makes the LVN more valuable and marketable if he or she has an IV certification.